Thank you very much indeed, Adrienne. And I know that the audience has found all of the 4 presentations extremely helpful. And I hope each of you on the panel has found each other's presentation valuable and presented some really good ideas. I think everyone has brought up the issue of governance. And that clearly is something that has to be solved. We've seen Beth, we've seen your organization just really starting out. We've seen Martina and BT with organizations which have defined very clearly their governance. You're slightly more complicated than the Japanese one, but nonetheless. But it clearly is a different issue. But governance is without a doubt very important. I'd like to open the floor to questions for any of the speakers, but remember that you've already had a bit of a crack at the whip. So over to Patrick.
Thank you, Jack. I have a question specifically for Martina. You addressed something that I've been wanting to have addressed for about 15, 18 years. I had a very successful partnership with my friend Georgia Len and CDC about 15 years ago to strengthen public health laboratory capacity in the Caribbean and in Central America. And a lot of it revolved around laboratory information management systems. At the time, CDC had a system that they developed, and we were basically propagating that system around the Caribbean and Latin America. Ironically, we had 9/11, and a lot of money was mobilized for biosurveillance. And the CDC decided to go out of the business of making their own software and just issuing specifications for companies to make laboratory management software. The problem with that was that though the US had a lot of money, the developing countries which were using all the CDC software did not. So they went from having a source of free software for managing public health laboratory systems and epidemiology to having no software, ironically. You shared on the development of this system, and I'd love to hear more about that and whether that is something that could be shared with the rest of the world, because to really build surveillance in these poorer countries, they need access, free, low cost or free access to those kinds of systems.
Yeah, thank you for your question. This tool that has been developed is an open access tool that is accessible for free from Fondation Mérieux and Teresa Lab. So it can be really provided to every country and everybody who is being interested in. And we currently further develop the tool to depending on the experience in the different countries, and every country can feed and give us feedback on what is needed on additional modules. So the tool is available, and we know about other tools because I know WHO Lyon is holding some conferences and meetings together, inviting people from CDC also to exchange experience on different tools. So yes, it is available.
You had a partner for developing the tool, you said?
Yeah, Fondation Mérieux was a partner in developing this tool, yeah.
You briefly mentioned another entity that I wasn't familiar with.
Concept, I mentioned. EP Concept, it's from Paris, somebody who helped us developing. And I can share
so you two
some
can
information.
Solve this in the encroaching break. We are going into the break time a little bit. So we've got Ben, Clarion, Carol, Simon, snappy questions.
Just a quick one. BT, this is for you. Is there anything promising in the dengue pipeline?
So we currently invest in a tetravalent vaccine. Compared to that of Sanofi and Takeda, it's a non-adjuvant, more of a virulent vaccine. In terms of drugs, currently speaking with 2 companies in Japan for dengue therapeutics as well.
One of the things you didn't address is, of course, drug development takes a very, very long time. Are your investors happy about staying with the course for 10 to 15 years? Or are you going to be able to do it in a couple of years? Because if you are, please tell me how you do that.
So as you saw in our portfolio, we invest both in late stage technologies as well as early stage. And late stage are already in phase 2. So with the current commitment of funds, the initial commitment was 5 years. Not next year, the following year, we'll have a replenishment. And at that stage, we'll be looking at a longer timelines.
I had a brief question for Adria. I made a statement yesterday when there was nobody from Gavi, so I would just like to repeat it. But your slide on total effort, if you want, invested is mostly in Africa, yet none of the vaccines, except maybe a bit of yellow fever coming out of Institut Pasteur in Dakar, is sourced from Africa. In your new version, shouldn't there be an ability for Africa to become less dependent on the rest of the world for vaccine production as part of the goal number 5?
Yeah, no, that's a very good point. And a lot of some of the success so far has been to have manufacturers mostly in Asia, and very little in, we don't have yet producers in Africa. We are not yet, we are not though in the kind of very much upstream production. The only incentives we provide is very much by providing the markets, by then doing some pooled procurements and actually relying on other partners. We're not involved much in these kind of development of the capacity. The Gates Foundation is much more involved in that. The Gavi board as an alliance has decided that we would be more on the buyer and the purchaser front rather than doing technology transfer incentives, etc. So we're not doing much in the next period on this.
It's an important question. Pfizer is part of the program with the 13-valent pneumococcal vaccine, which is immensely complicated to make because each of the valencies has to be added separately, and it takes something like 18 months to develop each batch of the vaccine. It's and that price that you see of 3.5, there is no profit on that. That's why it is $107 in the American market to cover that. But we have looked at manufacture in local, but I think we see it would be immensely expensive to do that at this stage, and may potentially hold up the supply of what's getting there. But
I just think that it is a good time at 15 years, and if you're really revising or rethinking how Gavi operates 15 years later, given this very picture, to actually consider that maybe the same donors, the same funders who invest in the system of advanced purchasing and creating innovative financing mechanisms can match that by focusing on the capability of Africa to become less dependent. It is part, if you also want, of risk reduction and disaster preparedness. It will be part, I think, of what Francis and I were talking about, so that Africa should start investing in its own science capability. So it has a two-edged sword, but I do think that mechanisms like Gavi, are so big and so influential and so positive that it should take it one step further and see if we can't create more sustainability in the research and innovation system that produces the vaccine.
Okay.
Thanks, Jack, for really interesting presentations. Thanks. Sort of a comment on governance, which ran through all of them, Adrian. I guess to you, we talked on day one about partnerships, sustaining them, evolving them, or dissolving them. And I think similarly with governance, there are times where you want to sustain governance. There are clearly times when governance has to evolve and change, and then there's a time when we want to wrap things up, job done, and move on. And I guess when you're looking at in-country partnerships, I think there are two ways of looking at this. One is seeking to work in different ways at the local level because the partnerships you've set up aren't working. So you want to do something different. And these were models set up based on that principle of partnership. Lean stewardship, things are out there, the architecture's out there, we want to facilitate that architecture to work. Setting up different sort of partnerships kind of erodes that a little bit. And as you say, you've got that dilemma between sort of lean stewardship over than getting involved. I would imagine the question around local production may be a real opportunity, a niche where you want to evolve into that way. But I would caution against evolving because of partnership failure. I would invest more time in making partnerships work rather than setting up, if we had Global Fund country offices and Gavi country offices, and we're going to have this plethora of institutions. And then a question on innovative financing. Is anyone thinking about an IFIM type facility for Ebola? Or an IFIM type responsibility for pandemic preparedness, because it seems that we've got 10 countries or 12 countries, I think, in IFIM that front-loaded Gavi. I mean, if you spread that across 100 countries, just think what the world could do in terms of having a preparedness facility for the next pandemic. Thanks.
So just on the governance aspect, so yeah, I don't think we would anywhere, we would actually go in having Gavi secretariat presence in countries. The things we're thinking about is potentially leveraging much more some of the in-country mechanism, like the ICC, the Interagency Coordination Committee, and really revitalizing that and playing a role to support these. The difficulty actually in setting up the right coordination governance process at the country level is that it should actually be done under the leadership of the country itself, because we're talking about immunization program of the country. So it wouldn't be anyway something that would be labeled as a Gavi alliance partnership, etc. But it's how do we create that forum for Gavi partners to engage with governments and be effective in helping the governments. On the IFIM one, not that, the only one that I've been aware, actually more coming from the World Bank, and that's more as an individual, but Gavi wouldn't. The question for Gavi is probably much more targeted around how do we fund a potential Ebola vaccine. We are starting to think about how do we set up the infrastructure for the next set of, the next pandemic, which might have a vaccines, but we are, I guess the bank is definitely thinking about preparedness funds similar to the IMF for financial crisis, but we're not in that part of that discussion.
No, I think the better coordination of funders for developing tools for preparedness, infectious disease preparedness is really important. And Fondation Mérieux is involved in the secretariat of an initiative that is called Global Research Collaboration for Infectious Disease Preparedness, called GLOPID. That is a network of research funders that has been initiated after recommendations of the HERO, heads of international research organizations. And under the European Commission was one of the initiators, and now there are several countries that are joining and several funders, and there is a close link with the research community in order to really be better prepared and set up a research strategy for infectious disease preparedness. So there is definitely a need for better collaboration, coordination in that domain.